men talk rubbish all the time. Like,
Yeah.
I do 5 times a day, 4 times. It's all rubbish. Nobody walks into a doctor's office and says, "Kato mujhe." You can do whatever you want in this world. You can't reverse time. Okay, that's just a biological fact.
Yeah.
However, better late than never. If the embryos are good, the eggs were good, the sperms are good, and the lining was good, your success rate can vary anywhere between 35% to 60%. Wives of smokers generally tend to struggle to conceive. Also, smoking will reduce your performance in bed. So why would you want it? The oral contraceptive pill is one of the greatest inventions of the last half a century. It has put power of choice in the hands of women. India as a country is the most liberal when it comes to abortions. Our laws are phenomenal.
Hello, Dr. Kapadia.
Hi, Bani.
How are you today?
Very well. Happy to be here.
It's a bit odd actually addressing you as I am because I've known you for so many years. And I'm sitting with you and having this chat, of course, as a well established doctor. But before that, you're like my brother and you're my doctor. So
You've never called me doctor in your
I've
life.
never called you doctor.
And this feels strangely weird. on the drive here, I was just thinking, this is not our first podcast. This is our first recorded podcast.
Agreed.
We've had plenty of conversations
Yes.
sitting like this in my sister's bedroom.
Yes.
Right from health to relationships to boyfriends to, I don't know, it's been what, 10, 15 years?
Yeah. It's been a while. 2012 onwards.
So yeah, 2012 onward. 12 years of talking, but first time being recorded.
Yeah.
Yeah, but it's fun.
It's fun. The thing is, there's just so much that I wanted to talk to you about. And I think particularly because I've been on a journey with you, and it's a journey that I have shared publicly. And I thought that, because so many people ask me questions about that, I thought the best person to have that chat would be you. Because, this feels like family having a chat, but also because I think that you are just so brilliant at whatever it is that you do.
You're very kind, Bani,
At
but thank you.
Namaha. Yeah. So I want to actually start by saying that, one of the most sort of profound moments of our interaction outside of all of those conversations that we've had in Manati's bedroom was that I came to you when I was just at the cusp of turning 30. And I told you that, I'm thinking that I want to freeze my eggs. And, I was just a bit perturbed or sort of insecure about the fact that I was not in any sort of long-term relationship at that point in time. And I think the number 30 just really rang a bell in my head. And it made me feel like, okay, I know that I want to have children at some point in time, but I also know that I'm not rushing into anything because of that.
Fair.
And when I went to some of the doctors in Delhi, unfortunately the experience I had was them telling me, but why aren't you getting married? Oh, but you need to get married. And that just really put me off. It put me off because it just made me feel like, firstly, that's not your business. And secondly, it's extremely discouraging because, how my life pans out personally, it's not even in my control. What I can do is just my best. I can be proactive. I can be, intelligent about my choices. That's about it. And when I came to you, you sat me down and you said, of course, we'll do this. But the first thing you should know is that the purpose of your life is not to just have children or to have children in its entirety at all. Like the purpose of your life is to just be you and have a great time. And you should know that. And it was so comforting to hear that coming from you.
Yeah, I think it's important for women to know, for everybody to know that you are complete as you.
Yeah.
Okay. Getting married, having kids, these aren't milestones that you need to achieve. But should you want to, you should do it on your own terms. They shouldn't be dictated by the fact that time is running out. They shouldn't be dictated by the fact that you may not be able to have a conventional life in the future and end up making a compromise. So that was the aim of telling you you're fine as you are.
Yeah.
However, it's important to take control of your life and say, for someone like you who was like, look, I'm not even sure. I don't want to jump into. I mean, there were probably lots of probable people willing to, get married to you, but you weren't ready. You weren't sure that they were the right
Yeah.
person. You weren't sure when you wanted to have it. So I wanted the ball to be in your court. So
Yeah.
that was important. I wanted you to be able to say, look, my eggs are frozen. I'll decide what I want to do with my life, my career, when I want to get married to, who I want to get married to, and when I want to have kids. So I guess that's the important thing of egg freezing for women who want to plan their lives, usually in their 30s, is that it gives you the control and takes a little bit of control away from the natural course of things.
Yeah. So, in this attempt to get a little bit more control, um, like, what is the right age to freeze your eggs?
Okay, so there isn't a particular cutoff age.
Yeah.
What you need to understand is that the earlier you do it, the better the results. What I would say is that girls should evaluate where their life is headed. Suppose they're doing very well in their careers, they have great opportunities coming up, say for the next 2 or 3 years. They're in a relationship, they're not in a relationship, but maybe it's time. They just don't want to take it to the next level. If they feel like, okay, I have about 3-4 years where forget kids, even marriage is not on the cards.
Yeah.
That's the time. And a good way to go about it is to go and just consult a gynecologist or a fertility specialist and speak to them. The first step would be like an evaluation. They'll ask you to do certain blood tests, usually during your period, etc. They'll do an ultrasound. They'll take down a little bit of your history, your family history, your medical and surgical history. They'll find out whether you're at risk of, you know, having a low AMH early,
Yeah.
and they'll check your AMH. Suppose you're 30, 31 and you come back with great results, like fantastic results. Everything is fine. If you're fortunate enough to be one of those women who has a wonderful, reproductive,
System.
future
Yeah.
system, and your doctor will tell you that, look, if it's a matter of couple of years, 3 years, don't go through this entire exercise.
Because it's painful.
It is difficult.
Yeah, it's difficult.
Certainly. I mean, being a male gynecologist, I cannot even comprehend how tough it must be. But that is the advantage of being a male gynecologist, that every problem that a patient comes to you with is a valid concern, because you never know how somebody's feeling. So every little problem is valid for me. So it is an incredibly tough decision, and it's a tough journey. But what I say is there's no treatment or there's no therapy or there's no action you take in life which doesn't have risks, consequences, and benefits. So you need to figure out whether it's beneficial for you to kind of torture yourself a little bit for like a couple of weeks.
It's like an investment.
I mean, yes, it is. So even if you are undergoing a certain surgery, if you're undergoing, say, corrective eye surgery, if you're undergoing a cataract surgery, it's not comfortable. Nobody walks into a doctor's office and says, "Kato mujhe." I'm excited, cut me open, do this. No, I mean, it's a tough decision.
Yeah.
But if I can see clearly,
Yeah.
if I can walk better for knee transplants, if I don't bleed terribly every month for a hysterectomy, if I can secure my reproductive future, then is that amount of trouble, is that amount of financial investment, is that amount of emotional investment worth it for me? And usually I feel that women end up making the choice that is correct for their life.
Yeah.
Some say absolutely not. ये मतलब मेरे से होगा ही नहीं. एक तो चाहिए नहीं बच्चे. For like some non-existent child in the
Fair.
future, and for some non-existent family which I may or may not want, why am I destroying like my time right now and burning this pile of cash and suffering so much right now? So it kind of clarifies things for them. And for some it is like, look man, no, I don't know, right now it's 30, I don't know how I'll feel at 38.
Yeah.
I don't know, I may just suddenly want kids, and at that time I don't want to have any regrets saying 32 पे कर लिया होता तो. That's the point.
Yeah.
So it's important that you have a professional helping you make these decisions. And these decisions are, I mean, crystal clear. When you get your blood tests and everything done, it kind of tells you, look, you have X amount of time, earlier the better, etc.
Yeah.
So yeah.
When I was on my journey, I think people in general shy away from talking about it a little. And I think I personally was reticent myself, I think for the first year or so, because I don't know, it just felt that I didn't want to be emotionally vulnerable and talk about. But then I also realized that through this process, I didn't have anyone I could talk to because nobody had really ever spoken about it. Egg freezing, of course, is the first step of IVF. So I'm sure there are friends of mine who've gone through, the IVF route, and they've not kind of discussed it openly because somehow people are, hesitant in talking about it. But then I was just like, I don't want to be that person who doesn't say, look, I did this because it made me feel so liberated
Yeah.
after, that, I would say that consider it. If, you have the resources, if you have the time, if you are at the same stage in life that I'm at, it's worth a consideration. But then I wanted to have this discussion with you because I just feel like when I was going through that process, I didn't really have too many people who were talking about it, and talking about it not in the casual sense of ऐसे हो जाता है or do this or just go to this doctor. Like I wanted someone to really handhold me through the process. So if we can actually walk through the process
Yeah.
of just the idea of, let's say there are two people, we'll discuss both. We want to discuss there is a single girl who's perhaps considering this, and then there is a couple who's perhaps considering having a child. I think let's consider the single girl
Sure.
part first. What are the markers that I should be looking out for when I am considering the idea of egg freezing in my blood tests?
Honestly, you shouldn't be considering anything.
Okay.
As a single woman thinking about egg freezing, I'm assuming you've done enough research to understand that, look, this is the process. I'll have to kind of, spend 2 weeks with a fertility specialist. You know where your life is.
Yeah.
You know how many years. 3-4 साल तो लग ही जाएंगे, there's no way my boyfriend is going to propose so soon. I've not found anybody yet.
Yeah.
Or I just don't want to be a mom right now.
Yeah.
My career won't allow it. Right now I can't derail it.
Yeah.
Maybe you are in film. Maybe you are in a very high-paced, corporate job where it's impossible to take this year and a half, 2 years off to kind of have a family and then have subsequent extra responsibility. So you know where you are. The first thing that you should do is go to a fertility specialist.
Okay.
Speak to them. They'll give you a list of tests to do. All of those tests not only check your egg reserve in your body, but also check what other hormones are out of whack or whether they're normal or not.
Yeah.
वो सब देख के, सोनोग्राफी देख के, they'll tell you कि नहीं यार कोई प्रॉब्लम नहीं है अभी.
Where are you at, basically?
Where you are at.
Yeah.
They'll tell you, look, next 3-4 years is not a problem. अगर 3-4 years, you're like, yeah, if it's going to happen, 3-4 साल में हो ही जाएगा. And then if it's not a problem, I don't mind not doing it.
Yeah.
But if they tell you, look, you're already at that phase where, say, if you were married and trying, you would anyways need assistance, then that's the time to do it.
Got it.
I would strongly recommend not doing like a deep dive into, okay, why is my AMH level so and so? What if it goes 2 points below 3? Then you check it from another lab. So 2 point बढ़ जाता है. Then 2 point then you get into this weird spiral where you're trying everything to grasp at source. Don't do that. A little bit of fluctuation is expected from lab to lab. So you let your professional decide. ये करना है कि नहीं करना है.
What is AMH?
AMH is a hormone in your body. It's called Anti-Müllerian hormone. It gives you a rough estimate of what your ovarian reserves are like. Now, for every girl, when she is born, she has a limited number of eggs she's born with when she comes out into the world.
Okay.
Now, even before she starts her periods, every month, thousands of eggs die. Now, some people are blessed with more eggs, some people are blessed with less eggs. There are certain genetic conditions which predispose you to having more or less. There are certain conditions like polycystic ovaries where आप ovulate नहीं करते हो throughout your teenage or early adult life, तो आपका AMH ज़्यादा रहेगा, किसी का कम रहेगा. So there are many factors for it, but that gives you a rough estimate कि भाई approximately how much time you have left. And there are broad markers.
What is a healthy AMH number to have?
Depends on your age. So say if you are in your 20s, absolutely regular periods, no PCO, no endometriosis, no ovarian surgeries, no genetic problems, things are going fine. You're just worried. Usually it should be like 2.5 or around that. So anywhere between 2.2 to even 3 plus is fine.
Yeah.
But say you're 30, 29 and it's like 1.2, 1.1, that's when you start getting like, okay, slightly lower than I want.
Yeah.
So you keep a little bit of a watch. You try not to panic. छोटे महीने के बाद वापस करके एक बार देख लो. The absolute count probably is not as important as the rate of decline.
Yeah.
वो देख लो, फिर देखो 6 months बाद like 1.2 का 0.9 हो गया, then you know कि
Hmm.
listen guys, let's not.
Yeah.
Or 1.4 होगा तो 1 हो गया तो something like that.
Yeah.
So the thing is, honestly and unfortunately, there is no like one cutoff value.
Hmm.
Like you may come to me at 38 and say I want to freeze my egg. I actually have women who like I wish I knew.
Yeah.
मुझे पता ही नहीं था.
I have someone, a friend I know, who's frozen her eggs at 42.
Yeah,
But
fair.
of course, the number of eggs that you get perhaps in your 40s or late 30s is different from what you would in your late
And
20s
not
and
only
early
the
30s.
number, even the quality.
Yeah.
Okay, you can do whatever you want in this world. You can't reverse time.
Hmm.
Okay, that's just a biological fact.
Yeah.
However, better late than never.
Yeah.
Okay, better late than never. कुछ ना कुछ तो कर ही लेंगे. Actually, I to tell my patient that look, you need to go to your gynecologist and say, look, this is the plan for my life.
Hmm.
I want to work till I'm 35, 36. We're working, my husband's working, or my partner's working, I'm working. नहीं चाहिए अभी बच्चे. Like I want a kid around 38, 39, when you're more financially well settled,
Yeah.
like we have our own place, etc. It's whatever it is their concern, and then we want to have kids. It's the responsibility of your gynecologist to make it happen.
Yeah.
At least that's how we function at Nama. I'm pretty sure everybody has their ways of doing it, and I mean pretty well at that. I'm
Yeah.
just speaking from my own personal experience.
No,
There is
some
a-
people just say you should get married now only, which is quite retarded if I.
yeah,
Like, I was so disheartened, which is why I was like, I don't know what is wrong with people. Why are they just not getting the fact that I've come to you anyway with this feeling?
look, I don't want to judge how other people this thing. What I generally tend to tell patients is there's no perfect fit. Like there's no one person for you.
Hmm.
You need to like see what fits your mindset the best. So some patients like being in a more stricter environment. They thrive in it. They like being told what to do. They like a more conventional approach to medicine. They like नहीं, I am the doctor. मैं जैसा बोल रहा हूँ आप करो. For example, कि नहीं ऐसा ऐसा करेंगे ऐसा ऐसा करें. So they thrive in it. They're like I like that structure.
Yeah.
I like that it is less casual, and I like that it it kind of forces me to take a decision.
Yeah.
Whereas it may not work for someone like you.
Yeah.
Okay, for someone like you probably think Nama is a better fit. Where you're like, no, listen, the priority is Bani.
Yeah.
बाकी सब गया भाड़ में. पहले बानी को देखते हैं. You should not feel like discouraged. You shouldn't feel what have I done with my life type of situation. I don't want you to despair.
Yeah.
Everything else is my problem. कभी भी हो कुछ भी हो, we will figure it out. So some people like that kind of approach. So I mean, I'm beyond the point of like telling people this is the right way to do it. It's fine because there are some people who have their own life experiences. Doctors are humans as well.
Yeah.
उनको भी कुछ ना कुछ हुआ होगा लाइफ में, उनकी डॉटर्स को, उनके सिस्टर्स को. So they are kind of some women
They're
fixate.
allowed to be jaded.
They're allowed to be
as well.
jaded. Maybe you go to somebody who told you नहीं अब शादी कर लो. Maybe she has a relative or a close friend who didn't, and it pains her, and she's like I don't want you to make the same in her eyes mistake.
Yeah.
तो मतलब ठीक है. It didn't work for you. नहीं किया ना
Yeah.
उनके साथ. So that's it. I mean I feel like it's not a crime. I just generally I'm a little more optimistic about the fraternity in the sense that most of the people, most of
mean
the
well.
doctors, they mean well. It's just that it's different how they articulate it. You've come hoping for this encouragement. You've come hoping
Yeah.
for, nahi, Bani, you're chill, yeah, the way you are, don't worry.
Yeah.
I don't want you to get you didn't get it from her.
Yeah.
She's probably coming from another place.
Yeah.
So always take a second opinion.
Yeah.
Always try to find what works best for you.
Yeah.
That's what I say. So.
Yeah. Fair. Okay, so now we've spoken about the fact that there are certain tests. If I'm considering this as an option, I go to a fertility expert or I go to my gynac, I get these tests done. AMH, of course, is a marker, a significant
One of them.
marker
Yeah.
to consider among many others. And then let's say I'm advised that, if you want to do this, go ahead. What starts then? What is the process like?
Boom, straight into the deep end.
Yeah.
Okay, so suppose you've come.
Yeah.
Okay, I'll tell you, okay, Bani, next day 2 or day 3 of your periods, I want you to do all these tests, get the reports, see me, I'll do your ultrasound, we'll see your ovaries, we'll see how many follicles are there in your ovaries. Follicles are a marker for how many eggs, etc. you may or may not have.
Yeah.
We'll see if you have any other concurrent, problems, if your thyroid is okay, if the uterus is okay, if the lining is fine, do you have any fibroids, polyps, etc., etc., etc. पूरा evaluate करके I'll tell you, Bani, AMH is damn good, यार. Like it's fantastic. अभी कर लोगे तो बहुत अच्छे eggs मिलेंगे, but if you're like, yeah, 2 साल के लिए does it make sense for me to do it? I'll tell you no. Now suppose you are one of my patients who has, say, a low AMH. I'm like, this is surprising. Like, Bani, you've been like a picture of health all your life. I've not seen anybody take better care of themselves. You don't smoke, you don't drink, you've never had substance abuse issues, you work out, you have a great life. Yeah, no family history, सब अच्छा है. तो भी क्यों low आ रहा है? Maybe they'll check it once more.
Yeah.
If it is still low, it'll be like, look better. I mean, just because you freeze your eggs doesn't mean कि IVF करके ही pregnancy रहेगी. You freeze your eggs as a backup when you want to have a baby with your partner. आप try कर लेना naturally like that. And then we decide कि चलो next month नहीं doc, we need to kind of make this happen. I don't want to take any chances and everything.
So I think we've discovered there are two approaches. एक is कि मैंने मन बना लिया, I'm healthy and I'm just saying अभी कर लेते हैं as my good insurance. Let's do it. And then it's like, I think I should because it might be a wiser idea.
नहीं, कोई reason होना चाहिए egg freeze का. You can't say कि I'm getting married next year, I want a baby next year. तो अभी egg freeze करके कोई मतलब ही नहीं है.
Fair.
If your reports are good.
हम तो singles की बात कर रहे हैं ना.
हाँ, still, but I mean singles with a possibility of you getting married in the next 2 years and everything is awesome, then why would you? But single with like, no man, not 5 years, so I want to live my life. So there's nobody in the horizon. Like, है ही नहीं ऐसे मेरी कोई company में जो, I mean, I don't socialize, only the prospect is only not there.
Yeah.
Then you have to do it. Yeah.
So now we've decided the tests are done.
करना है.
करना है. अब कर रहे हैं.
Boom. So for a natural cycle, most girls, what happens is, as soon as the periods start, a new egg of that month starts to form. Around day 12 to day 16, that egg ruptures from the ovary. If there are sperms there, वो fertilize होके अगर implant हो गया, तो you're pregnant, you'll miss your next period.
Yeah.
Suppose you're not trying for a baby, or suppose you didn't conceive that month, for whatever reason, you're single, whatever. That egg withers and dies, and all the lining that has formed in anticipation of a future embryo will shed, and that's your period.
Yeah.
The human body is tuned to make 1/max 2, usually, eggs every month.
Okay.
When we do IVF or egg freezing, we don't want 1 or 2 eggs. We want plenty of eggs. So what we tend to do is we override the body's hormonal status by injecting you with the same hormones that you would naturally produce, but at a slightly higher dose. What that does is, at the same time, जो natural body एक बनाता है egg, one will start to rise and the others will start to die down. We make sure that all of them start to grow together.
Yeah.
And the body's tendency to let only one dominate and put everybody else down, we have certain drugs to make sure that doesn't happen.
So to suppress that and make sure that more
sub all grow together.
Yeah.
And we give you injections from the first day of your period for about 12 or 14 days. Make sure that you make as many eggs as is safe to produce.
Not a fun experience, I must add.
It's not.
Yeah. Again, nobody told me that, on the internet when I was watching these videos, of these American, because very few Indian people have spoken about it. And they would just be injecting themselves and be like, oh, this is day 1, day 2. I'm like, अरे बताओ ना दर्द हो रही है. Why is no one saying it's painful? At least one of the injections that I took was really painful. I had to sit with like an ice pack after, and I was just like, oh God.
No. Injections are painful.
Yeah.
I mean, painful as much as injections can be.
Yeah.
Like any injection.
Yeah.
I mean, it's not like this is some sort of really dastardly injection that compared to other injections will make you like buckle over. ऐसा नहीं है. But this is not some walk in the park way. ये ऐसी magic needle है जो चुभती नहीं है.
हाँ. In fact, मतलब I'm तो not even afraid of needles. तो मुझे fear भी नहीं है. तो कोई blood test में भी कुछ भी नहीं होता. So it was not the needle. But of course, मतलब I wish again कोई disclaimer दे के वो जो लड़कियां बना रही थी videos वो मुझे बोल देती कि इसमें दर्द भी होता है.
But you know it's hard because we've had some patients who are like, this is a breeze, I don't feel anything. And some who are really sensitive. So it's very hard to generalize. If you would ask me that, is it going to be a comfortable experience? Then no. But is it going to be like this, oh my God, crushing, debilitating experience? in most of the time.
Yeah, it's not crushing, it's not debilitating.
Yeah, you can still go to work and you
Yeah.
can do everything.
Yeah.
Except वो last के जो 4-5 दिन है, you get a little more bloating and you feel
और
like
mood भी बकवास होता है उस time पे.
depends also cycle to cycle. Also, it depends on what kind of framework you're in. Also, like when you were coming from Delhi, you were taking your injections. You had a lot going on
Yeah.
in your life.
Yeah.
So I mean, it also depends on what stage of your life you're in, which is
Yeah.
fair enough.
Hmm.
Like ठीक है ना, कभी-कभी you have like a shitty month.
Hmm.
तो उसी month में भी egg freezing भी कर दिया सब कुछ. Things are going to get heightened.
मेरे तो
But-
साल ही गंदा जा रहा था, तो I guess that explains it.
Join the club. So yeah, I was not taking any
Yeah.
injections, but yeah, it's fine. Ultimately, a little bit of anxiety, a little bit of irritation will happen. But a lot of women ask me, will I become like, for want of a better word, batshit crazy? Like, will I, oh my god, I don't want to get that hormone. I'm like, no, usually it doesn't happen.
It doesn't usually happen.
doesn't happen.
Agreed.
Especially if you use like proper drugs, proper doses, don't get carried away. Most of them, 8 out of 10, it's not bad.
Yeah.
I'm not diminishing some women who do face a lot of
Yeah.
trouble. I'm sure. I'm by no means diminishing your bad experience with it, but usually it's
Yeah.
kind of, and
No,
even if you're
batshit
having a
crazy
bad,
is a bit
नहीं होता
much,
है,
हाँ.
होता है. Some people are like, I can't take it. Yeah, I just can't. Anyways, they might be a little labile emotionally from before. Might be a little stressed about it. We don't know what's going on at home.
Yeah.
What their general personality is.
Sure.
So ठीक है ना. Some women are going to feel. I mean, if the day I have a blood test, I am like a bundle of nerves. तो मैं कौन होता हूँ बोलने वाला? Like I hate needles. I hate tests. I hate any sort of procedure. Like I don't have a problem doing it to others. When it's done to me, I have a problem. So I am like a big fattu. So I have no right to judge somebody who has trouble accepting it. But all I'll say is keep talking to your doctor. Like if you're having a bad day, go on, just talk to him. If he's emotionally invested in your health, he or she, they'll sit you down and say, I understand. Every day come and talk to me 5 minutes. A little bit of motivation. 14 days, like go through it together, finish it once and for all and get out of there.
Yeah. So now we're taking the injections.
Yeah.
And
So,
now we've reached.
थोड़े बहुत दिन हो गए.
हाँ.
We'll be checking your blood test, whether you're responding well or no. We'll be doing your ultrasounds and seeing ovaries are responding well or not.
Yeah.
If need be, we'll be titrating your dosages accordingly. Some people need like, oh my god, you responded so well, we'll bring down the dosages. So somebody has responded like, एक और add कर दो. And that's like, when I say na, add this, the patient looks at me like, doc, no, don't add anything. I'm like, no, just like a little bit of a boost.
Safety.
हाँ, अभी कर ही रहे हो तो you might as well maximize it.
Yeah.
And then around like the 13th or 14th day when you're ready, you'll be called for like a trigger shot, which is usually at night because the retrieval will be, sometime in the morning, 35, 36 hours later. And once that's done, on the day of removing the eggs, you have to get admitted to the hospital for a few hours on an empty stomach. We take an IV and it's a short general anesthesia that we give. And the same way that we do your ultrasound, which is a transvaginal ultrasound, an internal ultrasound, उसी के द्वारा we retrieve the eggs. And the process takes about anywhere between 10 to 20 minutes, usually. And then you're in the recovery room, you wake up, kind of eat or drink something, use the loo. By that time, the team in the lab will let us know how many eggs there are, what is the quality of the eggs. And then you come and you chill and you say, अच्छा इतने सारे बन गए, अच्छा very good, सब freeze कर दो. And you're all happy and you go home. Or, like, look man, you got a great number of eggs. Only a few of them are very good. So we'll evaluate why, etc. And it depends from cycle to cycle. Some girls who have very good EMH will get away with like one cycle done. They're sorted for life.
What is a good number to get?
It depends. The more the merrier.
Yeah.
अभी 10-15 आ गए मतलब you're set, no? You're set for life. Like we divide them up into batches of 3. You a lot of this thing. But in our practice, the most of the people who are coming for egg freezing already are slightly of the older age group. So I would say anywhere close to 10 is still good enough.
Yeah.
10 to 15 is great.
तो इसका IVF में सक्सेस रेट क्या बनता है? 10 eggs का how many attempts will I get?
नहीं ऐसा नहीं है.
अच्छा.
So you don't have to say 10 eggs का कितना success rate है. It's about generalized success rate.
ठीक
So
है.
if the embryos are good, the eggs were good, the sperms are good, and the lining was good, your success rate can vary anywhere between 35% to 60%. Depends on the cycle. So there's been some cycles in our center where everybody has gotten pregnant. But to be honest, few and far between.
Yeah.
most of the time we fluctuate around 50%. And sometimes when you just have like patients who have borderline egg quality, the embryos aren't great, the sperms aren't very good, it happens. Sometimes like you'll get like a 15%, 20% result. But over a period of a year or so, when you even it out, somewhere comes to between about 50% is usually this. Anybody who tells you it's like a 100% result every time or like we always
वो तो नहीं हो
नहीं
सकता.
होता.
वो तो वैसे भी नेचुरली ट्राई करने में भी
I
फर्स्ट
mean,
अटेम्प्ट में
2%.
कहाँ होता है. हाँ.
2% is your natural trying 4-month success rate.
Yeah.
So it's hardly comparable.
Interestingly, as you said, the embryo has to be of good quality, which means that the sperm has to be of good
Of course,
quality.
yeah.
Unfortunately, you know, in India, at least we have this mindset that if a couple can't conceive, it's largely kind of pinned onto the women, the blame. Can we discuss how important sperm quality is in
Yeah.
conception?
It's 50% as important.
Yeah.
Literally 50% as important. So now being in an urban city, this problem is slightly lesser because there is some form of awareness that has come. Couples know, even women are strong enough
Yeah.
to understand कि नहीं 50% तो my husband. When I was in Navsari,
Yeah.
we used to struggle a lot with this. So we would have patients who've been changing hospitals, nursing homes, and everywhere they're testing, and everything's coming normal for the girl, for the wife in the relationship. The mother-in-law would come and नहीं नहीं देखो देखो उसमें गर्मी है उसमें ये है. I mean fair enough, that's how they've been brought up. ये करो वो करो सब कुछ देख लिया. The only thing not done is the husband's sperm test. हमने
हाँ,
पहले
ये
ये
कोई
तो करो.
सोचा ही नहीं पहले. हमेशा
नहीं सब
बार-बार
सोचते
टेस्ट
हैं
सब
लेकिन जब
गर्ल
भी
को.
कोई एडवाइस करता है वो चेंज कर देते हैं डॉक्टर. Because there's that fear, there's this power dynamic that probably exists in certain uh, families and certain
Yeah.
couples that he's very scared to do it. But the important thing is उनको भी counseling की जरूरत रहती है. I mean, yeah, it's a shitty situation to be in, and that, of course the wife has no agency in such settings.
Yeah.
So she can't be like कराओ यही नहीं कर पाते हैं, something like that. There's no way such things will come out of their mouth. There's no way. And we've had mother-in-laws fighting with us sometimes. उसका क्यों, उसको कुछ प्रॉब्लम ही नहीं है. बचपन से उसको कोई प्रॉब्लम नहीं है, कुछ नहीं है उसको, सब कुछ है. आप इसको बराबर से चेक करो क्यों नहीं इसको रह रहा है. And that has been the history of our civilization.
Yeah.
Kings have repeatedly beheaded their wives for not being able to give them an heir, and married queen after queen, not realizing that the king has the problem.
Yeah.
So that exists. So a remnant of that exists in our society even today.
Yeah.
But it's changing. Doctors are becoming more muffat.
Yeah.
In saying, नहीं इसके आप ये नहीं करोगे मेरे पास आओ ही मत. I could literally say, and I can sense the sometimes नहीं हुआ, no, I couldn't do it. It was a stressful time at work. That's when it needs more counseling.
Yeah.
So instead of kind of being a little bit rough with certain couples, you have to sit them down and say, look, what are you scared of? Are you scared that it's going to be like a low sperm count or a poor sperm count? Like, because I'm in so much stress. My dad is not well. I've been smoking and my job is very stressful. Like, I'm worried. And then he's worried that if it comes on him, that whole dynamic in the relationship will change.
The power play.
I understand.
Yeah.
Because that's all they've seen, in their lives. So then you have to tell them, look, even if you have, can I say shitty?
Yeah, you can say.
Even if you have the shittiest possible result, okay? The onus is not on you. The onus is on your doctor and your healthcare provider to say, you want kids, no? We'll make it happen.
Yeah.
We'll make it happen. Even if your sperms are good, sometimes a lot of husbands will come and say, look, doc, when you've told us our fertile days, no? Day 12, day 14, day 16, day 18, you have to have sex. Those are the days I can't.
Performance anxiety.
You're taking the intimacy out of the equation. You're taking the joy out of the equation.
Yeah.
You're making it a
technical process.
And the thing is that his body has to change to have sex.
Yeah.
He can't just, perform at will. He can't do anything. It has to respond.
Yeah.
And that's where the psychological effect takes place. And then if it doesn't happen once on day 12, he's so worried on day 14 that all day in office also while he's coding or he's doing something. I have to do it. 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 And by the time it's time to do it, it doesn't happen. A little bit of disharmony creeps into the relationship. The wife will get a little frustrated because she'll be like, "Arey yaar, doctor said yaar that one thing like 12, 14 day karna hai. Try no." And then he feels even worse about himself. Like, you know, he feels like, oh, am I not a real man? Like, what is happening? People bloody do it. Their friends talk, you know, men talk rubbish all the time. Like,
Yeah.
I did 5 times a day, 4 times. It's all rubbish.
Yeah.
So it's all bullshit. So all of that plays and it kind of perpetuates this vicious cycle. जहाँ उसे हो ही नहीं पाता. So that's when the doctor says, listen, man, chill. Outsource the baby making to us.
Yeah.
You guys continue and chill and enjoy yourselves.
Yeah.
Okay. That takes a lot of pressure off
Yeah.
of the couple. So that's what we're here for. Once the husband kind of understands that, look, I'm not going to be judged. I'm not going to be judged for my sperms. I'm not going to be judged for my ability to, you know, have sex that often or on demand like that. I'm in a safe place. So it's important to have like a safe environment where you have to. And even I counsel the wife also. That look, sometimes, you know, the same way how his behavior affects you.
Yeah.
Where he's dismissive, he's a little arrogant, he's a little. It's the same thing when you show your disappointment by like even a certain look, rolling your eyes or just sighing can kind of be emasculating for him.
Yeah.
So what you need to do is just laugh about it. A little bit of humor in the bedroom goes a long way. Just laugh about it and say, man, oh God, yeah, we're never going to be able to have kids. Like, laugh about it and come to us and say, boss, when you tell us the date, then it never happens.
Yeah.
It really puts the pressure. Then I know how to deal with that couple. So yeah, it's changing. I guess a lot of counseling for men helps.
What are the healthy habits that one can incorporate, you know, to have like a good egg count or a good sperm count or good quality eggs or good quality sperm? Like, because there's a lot of debate around, like, you know, habits like smoking and drinking, which is worse for women, which is worse for men.
So there's no debate. Any toxins in your body are bad, per se. So if you are smoking regularly, even vaping, even doing shisha, etc., it is going to affect it in a certain way. Have we quantified exactly how many cigarettes a day will cause your eggs or your sperms to become bad? No. But any amount of cigarettes. For some, it may be as little as 2 cigarettes a day. And we've seen people who are chain smokers having 2 packs a day, having three kids, no problem at all. But overall, in the general scheme of things, avoid any toxin. So if you're trying to kind of conceive, I would say smoking, absolutely not. Wives of smokers generally tend to struggle to conceive if they're in infertility treatment. They tend to have more miscarriages. They tend to have a lot more trouble. Also, smoking will reduce your performance in bed. So why would you want it? With drinking, it depends how much you drink. Most Indians don't drink as much as we think regular drinking is. Like if you are in the United States or in Europe, a glass of wine every day is normal. Right? The Indian body isn't suited for that much alcohol. It isn't suited for that much alcohol. So if you're telling me, doc, in the weekend I go out with my friends, can I just have a glass of wine? We're trying for I'm like, yeah, that's that detox for 3 months before you even start trying. I won't take a sip of alcohol. I won't. That's a little far-fetched. But any change in your life where you're cutting out bad habits, smoking, vaping, shisha, weed, substance abuse, processed food, a lot of sugar, getting a little bit of exercise, etc. If you're doing anything, I mean, if your overall health improves, everything improves. Yeah. If your sperm count is really, really low, the damage has already been done. Either it's been done by genetics, either it's been done by some infection in childhood, either it's been done by smoking, either it's been done by some injury, whatever it may be. It's very, very rare that it'll come back to like superstar levels. So the idea is to act fast. Same thing with AMH. With AMH, the predominant role is of genetics. And it doesn't mean that your mom has to have had low AMH. No, you are particularly born with a certain sequence that has led you to deplete your eggs faster than somebody else. Yeah. Or you've been born with less number of eggs. Now, there's no point going in a deep dive saying, oh, but my sister, but my mom. Theek hai na. You've also got certain attributes that they haven't got. Yeah. Okay. Reducing smoking, reducing alcohol consumption, eating healthy, eating certain antioxidant-rich foods, etc., will kind of help a little bit.
Yeah.
But if you're telling me, can it completely reverse it and replace things? Unfortunately, medical science hasn't yet proved any particular method to kind of save
Yeah.
your reproductive potential just from diet and exercise. So medical intervention, unfortunately, right now is the way to go.
And do cortisol levels have a role to play in like your AMH count or any other marker for, let's say?
Well, I'm sure cortisol levels have a role to play in everything. But again, like I said, not enough work has been put in to kind of correlate exactly what is the balance that you need, etc. And by the time you actually come to know you have low AMH, which correct karke itna, you're not going to achieve much.
Yeah.
The medical science is a continually evolving field.
Yeah.
If you told me 15 years ago that this is what we'd be doing, I'd be like, really? Like, seriously? Like, this is what we'd be doing? There's so many things we do different now than we did 10 years ago. And there's so many things we'll be doing different 10 years from now. So, yeah, the very, very smart people around the world working at making life easier and trying to make sure that couples can have the best, life they can lead. So, I'm very hopeful that things will come about, that we will be telling young girls, do this, do this, do this, you know. And there's so much work going on in preventative medicine that I'm hopeful, but science takes time.
So, we've kind of discussed the things that we perhaps can do to aid this process a little bit for both men and women, because they both have an equal part to play as
Get a little healthier.
Yeah, get a little healthier in general, because that'll lead to better, fertility health as well. When we go back to, let's say, and circle back to the conversation about freezing one's eggs or going through the IVF procedure, once we've kind of retrieved the eggs, of course, let's say for a single woman who's kind of gone through this process, whenever she wants to use her frozen eggs, she'll perhaps contact her,
the center where the eggs are frozen.
Yeah.
And her partner will have to come with her.
Yeah.
And then be like, okay, we're ready.
Yeah.
We've been trying since a while. It's not happening naturally, or for some reason we can't do it naturally. And we're both now in our late 30s. It's not happening. It's time to use my egg.
Yeah.
Fair enough. So we call the husband in a particular day, and we prepare the female partner for a couple of weeks before that with certain medicines to ensure a great lining. We thaw some of the eggs out of all that are frozen.
Yeah.
We fertilize them with the sperms, or we thaw all of them, fertilize everything, put them in the incubator. We wait about 3 days or 5 days, depending on how many eggs you have, etc. Various conditions. See which are the good embryos fit to be transferred, and we transfer them in the womb. 2 weeks after the transfer, for 2 weeks you're put on certain amount of medicines, a few injections, and in 2 weeks we do a blood test. Blood test or even a urine pregnancy test, but a blood test is more quantifiable.
Yeah.
So we do a blood test and we check whether you're pregnant or no. If you're not pregnant, we'll stop everything, you'll get your period and we try again as before. If you are pregnant, great. The medicines continue for a while. You'll have an ultrasound in another 10 odd days to see whether it's one embryo or whether it's like a single pregnancy or like a twin pregnancy.
Yeah.
Whether it's at the right location, whether it's growing well, and then we take it forward as a normal pregnancy.
So, once you've kind of gotten the sperm and now you have a few embryos, I presume you would implant at the same time.
A couple.
Because you don't want also a very high.
Yeah, we don't want multi-fetal gestation.
Yeah.
I mean, the max is twins.
Yeah.
To be honest, in our center, a lot of couples will come. They will come asking for twins. They will be like, "But yeah, we're doing this. We don't mind twins. We would like it if it's twins." So I have to kind of counsel them that, look, twins is not like a bonus result. Twins is a complication. Okay, the human body was designed to carry one baby at a time. When you have twins, you increase the chances of miscarriages in the first trimester. You increase the chance of, sometimes, depending on the type of twins, there are a chance of malformations in the baby. You increase the chance of preterm delivery. You increase the chance of abnormal placental attachment, like low-lying placentas which can bleed, etc. and then you increase the chance of if there's preterm delivery, need for the NICU, etc. later on. Not only that, I mean, think of the mother carrying two babies at the same time, nursing two babies at the same time, the first 1 year. So all of it is exponentially more difficult than
Yeah.
having one baby at a time. So we tell them that, like, look, if you do end up getting twins, we'll manage it. But if you ask me what I would really hope for, I'd hope for one baby at a time. So yeah, so we put in two, and yeah, we'll take it from there.
And of course, one has assumed that the reason why we have the embryo is because we've tested the sperm. The sperm is good quality, and
Yes.
now we know that the embryo will be of high quality as well.
We don't know that. So only when we kind of inject it and we grow it, and the proof of the pudding is in the eating.
Got it.
Only जब अच्छा embryo बनता है तभी पता चलता है.
वो टेस्टिंग से नहीं पता लगता.
नहीं, I mean, it's a visual testing. So there are tests now where you can do genetic tests on the embryo. So the many forms of genetic tests available now. One is कि बनते हुए embryo में से we remove one cell. Imagine 8 cell का embryo है, या अगर 5th day embryo है तो ज़्यादा cells हैं, but एक cell निकाल के उसको testing में भेजते हैं.
Yeah.
And we test it for normal genetic disorders, like the common ones, even the rare ones. There's another newer way of doing it, जहाँ जो liquid में जो embryos float हो रहे हैं, वो liquid निकाल के we send it for testing. It's called spent media genetic testing. और उसमें से पता चलता है कि genetic fault है कि नहीं बिल्कुल. This has certain advantages. The most important advantage is कि अगर the commonest cause of a failed IVF or a miscarriage or a baby is कि कोई genetic fault हो गया. Now that doesn't, it's not only IVF related. The most common cause of miscarriage is even otherwise for normal women or is some genetic problem that occurred naturally in the developing embryo, and your body recognizes and you bleed out, for example, or the embryo ceases to grow and you have a miscarriage, etc. Same thing here. However, to blindly apply it to every embryo doesn't make sense. Now somebody is young enough, it's a young couple, कोई actually family history है नहीं, so we don't generally push patients into that expensive endeavor. लेकिन suppose multiple miscarriages है, multiple IVF implantation failures हैं, you've had a baby with a genetic fault, you have some family history of both of you are thalassemia minors, for example. You need to test the embryo. So that's the testing.
How expensive is this extra step that you don't recommend if needed?
So the thing is, you can't test one embryo, no? Suppose you have 15 embryos and you have to test all 15. So अगर 2 embryo है तो it's less expensive. अगर 15 embryo है तो it's more expensive. So that's the point. The point is कि IVF itself is so expensive. So it depends from center to center. Like say if you're in a bigger city, it'll be more expensive because the person coming to do it charges more. If you're in a smaller center, it'll be less expensive. So it's you can't put a number on it, but think of it कि भाई 20% तो minimum बढ़ ही जाएगा. But it's honestly much more than 20% of the cost.
And what if the embryo, now we've implanted it? What if it doesn't take? What are like some of the primary reasons outside of like this genetic predisposition that
honest answer? In most patients, we don't know. We genuinely don't know. So there are cycles where we'll have great eggs, great sperms, damn good embryos, damn good line. Everything is perfect. I've told the patient, I've never seen a better embryo. Phenomenal. And there'll be the second patient जहाँ कच्चा पक्का आ रहे हैं टकर टकर कर एक दो एग मिले हैं, sperms also भाई क्या होगा पता नहीं, embryos are there, not that great, she'll conceive, she won't conceive. That's the difficult part of IVF. That's the difficult part of being an IVF consultant, that question why. I can't explain why her and why not you. So patients will be like, doc, I want to know what went wrong. Like, I don't want to do another. First, find out what is the reason. So again, like, you'll have your doctor have to tell you, look, honest answer, we don't know. Maybe shitty luck. It just didn't stick. The idea is to just keep throwing darts at the wall. Eventually it will stick. The point is that if I found a problem that you have very, very bad embryos or very, very bad eggs, that's not a good situation. So don't always try to say, give me a reason. Because if I could give you a reason, your success rates for the next one drop dramatically. Whereas if everything was great, your success rates for the next one stay the same. So don't pray for a problem. It's okay to say, okay, it's just part of, it's statistics.
Yeah.
The reason is stats.
Hmm.
That's the reason it didn't happen. When that understanding comes along, saying that IVF is a process, it's not a yes or no question, it's not a pass or fail exam. The way to counsel is that, look, we are going to transfer 3 times, 4 times. Eventually, in one of them, you'll conceive. Hopefully, most of the times. Cumulative pregnancy rates over 3-4 cycles is close to 80% if things are good.
Yeah.
So you have to tell them, look, we are going to transfer 3-4. I don't know whether you'll conceive in the first one or the fourth one. You just have to kind of
Power through it.
easier said than done, but yes,
Yeah.
you have to.
Yeah.
Yeah.
Interesting. What role does, let's say, a girl? I mean, PCOS is really common now. Every third person that I know kind of says I've been diagnosed.
It is
with.
fairly common.
Yeah. Does it make the process of conception easier or harder?
No, harder. Harder. Definitely. Because PCOS, so a lot of patients go, you have polycystic ovaries, polycystic ovarian syndrome, or PCOD. I'm like, look, polycystic ovaries is a spectrum of things. Okay. It may cause you to have bang regular periods or very irregular periods. It may cause you to have heavy periods, very scanty periods. You may be very, very lean, or you may be very, very overweight. You may have no skin issues, or you may have everything. The problem with conceiving when you have PCOS is that if you don't have regular periods, you don't know when you're ovulating.
Yeah.
How do you try? When do you try? Sometimes you may get your regular periods and still not ovulate. So that's the problem with PCOS. So yeah, it does make it hard to conceive, but it's easily manageable. It's, if you have PCO and if you're listening to this, please don't get stressed out. All you can do is take good care of yourself, inculcate good eating habits, good working out, get some sunshine, play a sport, etc. And then when it comes time to conceive, we'll figure it out. Most of the girls with PCO don't end up needing IVF, if that's what the question is.
Yeah, because they automatically have a very high AMH. So let's say
the AMH is besides the point. The
Yeah.
point is that when people are listening to this, they shouldn't think that, oh, I'm 20 to have PCO. Does that mean that I'll need IVF to conceive? Then I don't want kids. No, that's not true. A majority of girls with PCO will still conceive naturally, and maybe even with a little bit of assistance with the tablet or something for ovulation, or maybe just a few scans to see that, okay, you're ovulating. This is a good time to be together, etc.
Yeah.
A very, very small percentage of very, very severe PCO with probably some other factor or the male factor, etc., will end up needing IVF, which is also fine.
Yeah. You just mentioned a tablet, and it got me thinking about, the endless debate about birth control. There are people who are strongly for it and use it very regularly, even though it's not to moderate any cycle or manage any sort of PCO condition. It's just because that's a choice that they make.
Yeah.
Often encouraged by their male partner, because they feel like they don't need to use protection then in that case. And of course, a lot of the times it's kind of recommended by the OBGYN because it's kind of necessary to monitor or moderate or fix their cycle. So what is our sort of opinion on this?
The reason why birth control is recommended the most, or why many women choose to take it, is that it is the most foolproof method of contraception. Most of the times when people are taking it, it's because they know that they are in control of their choices of pregnancy. There's a very, very large failure rate as compared to with, say, a condom, or certainly not pull-out method, etc., etc. A birth control pill is phenomenal in terms of contraception.
Okay.
However, there are many, many alternatives to it if you don't like it.
Yeah.
When you say that most men would kind of pressurize their female partners to take it just so that they don't have to take care about it.
Yeah.
I mean, then that's something wrong in your relationship anyway.
Yeah. I mean, I've heard too many friends kind of discuss this and...
Yeah, but I mean, the reason why you should take it is not so that your male partner doesn't have to take care.
Yeah.
I mean, then there is something fundamentally wrong about the dynamics of your relationship. The reason why you should take a birth control pill is that it is the safest form of, the most foolproof form of contraception.
Yeah.
If the only reason is the husband doesn't want anything, you can do a vasectomy as a permanent source. If it's impermanent, use a condom. But uh, I am not very anti oral contraceptives.
Hmm.
I am just anti-oral contraceptives as a forceful method of contraception. Like if I give you oral contraception and you tell me that I'm just not happy with it, yeah, I'm putting on weight with it, or my skin breaks out with it, or it makes me very very emotional. Stop it.
Yeah.
You don't need to take it. There are a million other forms of contraception.
Hmm.
Okay, it has to be tailored to you. Sometimes it's trial and error.
Hmm.
And even with oral contraception, I would urge whoever's listening to take their time. Maybe the first month is bad. There are a million alternatives to oral contraception. There are millions of brands. There are so many brands that you could use. Try it out.
Hmm.
Also, oral contraceptives are great when it's a monogamous relationship. When you're in a long-term relationship, single partner, you don't have high-risk sexual behavior. You're not like sleeping around with a lot of partners, which is fine. If that is there, you have to understand that oral contraceptives don't prevent against STIs. It is
Yeah.
only contraception.
Got it.
Yeah. We have a lot of couples who come in thinking IVF is this acceptable contraception for the time you don't want to wear a condom. And I have to tell them that IVF has a huge failure rate, and they look at me like, "Are you serious?" I'm like, "Yes," and it like messes up your cycle a little bit. It's just it's emergency contraception.
Yeah.
It's called emergency contraception for a reason. It's when other forms of contraceptives fail. It's when a condom breaks or slips out or there's spillage. It's only then as an added protection that you have to take it. You can't just say, okay, I'm bored to wear a condom today. I don't want to wear it. I want to be on natural. And that's why I'll use an emergency. That's
Yeah.
not how it works.
So, with the IPL or oral contraception, the pills for oral contraception, do they mess up your hormones, your natural cycle?
It suppresses your natural cycle. That's how oral contraceptives work.
Hmm.
They replace the natural flux of hormones, which causes the egg to develop, rupture, and then if you don't conceive, you get your baby. It changes that. It replaces the hormones that are naturally cycling in your body with a more static form of hormone in which you don't ovulate. So that's how it changes it.
But ये बुरा नहीं है.
नहीं,
Hmm.
नहीं. Actually, बुरा नहीं है. The only thing बुरा with it is compliance and tolerance. If you are the type of person who can't take a pill, yeah, three weeks in a month, you can't. मैं भूल जाऊंगी. Like I can't take it regularly, or you can't tolerate it. It's giving me a lot of nausea. It's making me bloat. Like it just I feel like crying all the time with it. Or I put on like 2 kilos of weight in 6 months with it. Speak to your doctor about it.
Hmm.
Either he'll give you an alternative to that particular brand or drug, or he'll change you to something else.
Hmm.
However, it must be understood that the oral contraceptive pill is one of the greatest inventions of the last half a century. It has put power of choice in the hands of women. And we think from a very narrow point of women thinking, ये married couple है, husband को पहनना नहीं है, इसलिए ये ऐसा नहीं है. Think from a global point of view, where women had no choice, where partners wouldn't listen. They'd get impregnated again and again. This puts the power in your hands. That I will not get pregnant. I do not want to have a third child just because you want, in the olden times, a male heir or a male child. I can't go through childbirth again. मैं नहीं करूँगी.
Hmm.
That's your power. So the villainization of the birth control pill is wrong.
Hmm.
However, doctors also must not roll their eyes at intolerance to it. Some people just don't like it.
Yeah.
Some people are with. I have patients who will say, "Doc, I get bad headaches with it. I get migraine with it. Cancel. नहीं लेंगे. कुछ और सोचेंगे आपके लिए."
Hmm.
Some girl will be like, "Doc, I'm just crying. Like literally, I have wept for it." Fair enough. Good, you told me. Next cycle, we change something. Or doc, I throw up every morning. Like I can't go to work. I feel queasy. I can't eat. Cancel.
Hmm.
But a very large percentage of girls will be like, I like this. This is fine. I have PCO anyway. My periods don't come regularly. And then when they come every 2 months, I bleed very, very heavily.
Hmm.
Or I get it every 3 months, 4 months, 6 months. When I'm traveling, I get it. When I'm in my friend's wedding or something, I just started bleeding on the night of the Sangeet. Means I don't get my periods regularly. There's no way for me to plan anything in my life. For such girls, it's a boon.
Yeah.
And there are newer versions of oral contraceptives available which causes less bloating, which improve your acne, they improve increase facial hair growth. It's a blessing.
Yeah.
वो अगर आपको सूट हो गया, ग्रेट. नहीं हुआ, जाओ डॉक्टर के पास मांगो. ऐसा थोड़ी है कि एक ही लेबल है ये या कुछ नहीं. It's not like that. The idea is that healthcare is an ongoing conversation with your provider.
Yeah.
Your healthcare provider also has to adapt to your likes and dislikes. Neither of you can be as stubborn and dogmatic.
Yeah.
Okay. And even if your patient is stubborn and dogmatic, you have to take that into consideration and change for them and adapt to them and their likes and dislikes. And I think it is less the oral contraceptive pill rather than the pressure to take it that causes the issue. You have to tell them, ये choice है. These are the advantages, these are the disadvantages. There's never a perfect solution for everybody. For some, it's great, but it's not bad for everybody. That's what I'm trying to say.
I mean, it's an interesting perspective because I've gone back and forth on how I feel about it. I've never taken it. I've just kind of.
आपके कोई फ्रेंड ने बोला होगा कि like my husband saying नहीं I won't take you take the pill. Now the whole pill की image ही बदल दी है.
हाँ, मतलब मैंने तो यही सुना है.
It's you or me, no? Now you take it. You don't want to get pregnant. I'm not going to use anything. So the way you portrayed the pill is a bad thing. So if I flipped it across and I told you that a girl in interior some tier 3, tier 4 town or village comes and says, my husband doesn't listen. He doesn't have that understanding only. He just doesn't have that understanding. He's saying, हो गए बच्चे तो क्या है 4 हो 5 हो 6 हो मुझे नहीं करने बच्चे. चाचा मैं जाके मेरे PHC से मेरे लोकल वहाँ से मैं लेती हूँ उसको पता ही नहीं चलता. हर महीने मुझे पीरियड भी आ जाता है उसको यूज करना हो करे ना करना हो ना करे मुझे बच्चा चाहिए नहीं. Isn't that empowering?
It is empowering. Of course, the mentality shift would be the most empowering, where a situation like this doesn't arise in
It's about
the
how you
perfect world.
introduce it.
Yeah.
It's about how you introduce it, how you use it. You should never be forced to do anything with your body.
Yeah.
I mean, there are a million other ways to kind of stop conceiving.
Yeah.
But the oral contraceptive pill, the birth control pill, is a very, very important part of that buffet of things available.
Fair. Yeah. I mean, yeah. Definitely a fresh perspective on.
And a lot of people wonder, इतने hormones दोगे तो मेरे कैंसर हो जाएगा, यूट्रस हो जाएगा. ये नहीं होता. It's actually protective against also a lot of cancers. Yeah.
अच्छा, in all of this, मतलब जितना भी हमने पूरा डिस्कस किया है, egg freezing, IVF, conception, do's, don'ts, you know, sperm की health, egg की health, etc., etc. We are now at a part of a journey where, let's say, the woman who wants to have a child has conceived. What are some of your recommendations that she should do to have a healthy pregnancy and she should not do to avoid any complications?
So the don'ts in pregnancy are fairly common sense. No drinking, no smoking. Try to eat as healthy as you can. Avoid processed food. Control your intake of fried, oily, spicy things. Control it. Not completely avoid it, but control it. Cut down on sugars.
Caffeine?
One cup of coffee a day is okay, but I don't. There are so many of my patients who are so used to like having an espresso in the morning and one at work and one in the evening. So that I don't recommend.
Yeah.
Not only because it causes a little bit of elevation in your normal basal heart rate, it causes you to be a little more jittery. It's irritant to the stomach lining, and generally caffeine isn't good for a developing fetus. If you can avoid it, great. If you can't, you just have to have one like a slow diluted cup of coffee maybe through the day, but not more than that. Avoid soft runny cheeses, so no brie, camembert. Avoid unpasteurized cheeses. As far as possible, avoid MSG, but the jury is out on that one because half of the world probably eats things with MSG in it, and in pregnancy and it's fine. So that's the common thing. Do's stay happy, eat well, hydrate enough, a lot of color on your plate, a lot of leafy green veggies, as many fruits as you can, enough amount of protein throughout the day, and that's about it. Try not to put yourself in a box. A lot of girls who get pregnant will do such a deep dive on the internet and figure out the ideal way they want their pregnancy to go and deliver. And sometimes it doesn't work out and they get very disheartened. So the important thing is to say that, look, what is the primary objective? A happy, healthy mother and a healthy baby at birth with a non-traumatic birth experience.
Yeah.
Now, however that happens, great. If it happens according to how you envision it, fine. But sometimes, should a medical issue come up, so you develop diabetes in pregnancy, high blood pressure in pregnancy, you develop a little bit of hypothyroidism in pregnancy, your baby's a little underweight, overweight, you are a little underweight, overweight. Every pregnancy can't follow a particular formula, and take everything you read online with a pinch of salt. Uh, it's very boring for you to read a blog which says, "Okay, I tried, I conceived, I had an uneventful 9 months, and an uneventful delivery, average weight baby, and my baby has average milestones." It's just not a fun read, no. So most of the things that will kind of get clicked on will be where something bad happened.
Yeah.
And how you fought back through it, or like a traumatic experience which interests people in knowing, okay, this can also happen.
Yeah.
I developed this. It may not be you.
Yeah.
Most of the times it won't be you who'll have this really terrible experience.
Yeah.
So take everything with a pinch of salt. Social media can be a little daunting in times like this, and you'll get 1,000 different opinions, because there are 1,000 different opinions.
Yeah.
The idea is to kind of tread the long and narrow. In everything in your life, you may be outstanding. You may be in the top 1 percentile of everything. In pregnancy, better not to be. Yeah.
Agreed.
So the
Fair.
50th percentile is, I tell people in pregnancy and in childbirth, it's better to be average.
Yeah.
Don't be outstandingly bad or outstandingly great. Either ways is worrisome. Like,
Yeah.
why is this baby that heavy or that underweight, or why is the blood pressure here or there? Just say, okay, look, when it comes to this in my life,
Average.
that
Strictly average.
strictly average. Just, I don't want to deviate into any outside the mean. So that should
Yeah.
be the end.
Yeah. Agreed.
Keep it simple.
Keep it simple. I've heard this and then I thought I would ask you this, and then we kind of, the conversation went where it went. But when we were talking about choice and empowerment, one of the things that I do want to talk about is abortion.
Yeah.
Kubra, who's a friend, has written a book about her journey with abortion. I'm sure there are many people who come to you with the same.
Yeah.
What is usually their experience, their hesitation, and how do you kind of deal with something like that?
I'm a big Kubra fan.
I'm a big Kubra fan too. Yeah.
I really like her, and we've bumped into each other a few times. So she's a very, very amazing person. When it comes to abortion, I'm very liberal about it.
As one ought to be, I believe.
No, I'm liberal about it, but a lot of people think that as the world is regressing into fundamentalism, even in the United States with the reversal of Roe versus Wade, what we have to acknowledge is India as a country is the most liberal when it comes to abortions. Our laws are phenomenal. It gives the entire power to decide whether to have a child or not to the woman.
Yeah.
I mean, if I told somebody this right now, somebody who didn't know, they'd be like, "Are you mad? India? Liberal about abortion?" Yes, we have a fantastic set of laws and fantastic guidelines by our, national body of, it's called FOXY, on how to deal with it. Right from very early pregnancies, say below 7 weeks or 1.5 months of pregnancy, there are perfect guidelines on how to deal with certain pregnancies with medicines, how to deal with certain pregnancies with a small procedure like a suction evacuation, like a DNC, or how to deal with something which is less than 24 weeks.
Yeah.
So it's a fantastic set of laws, number one. Number two, most of the trepidation about having an abortion comes from the person undergoing the abortion.
Yeah.
There is so much guilt involved. Okay. They feel like, oh my God, I'm taking a life. Later, when I'll want to get pregnant, I won't be able to get pregnant, and this is why my karma is going to come to bite me in the ass, etc., etc. Whoever is listening, this is a terrible way of thinking. Not a terrible way, but I don't agree with this way of thinking. My point of view has been that being forced into motherhood or bringing a child into this world where you are not prepared or where you don't envision yourself being able to give that child all that you wanted to give, that's much worse.
Yeah, agreed.
If a termination of pregnancy or an abortion is done safely in the presence of a competent team, you should have no problems conceiving in the future. Either even if it's been done by pills, even if it's done by like a DNC, a small procedure, or even if it's done much later in your pregnancy, you realize much later, like in your 4th month, and you had to like have a small delivery and you will be able to plan your family as you want to plan it.
Yeah.
So that has to be taken out. Second thing, yes, it's a very emotional time. It is upsetting.
Yeah.
Okay, these thoughts will cross your head that I should have been more careful. Okay, that's fine. What has happened has happened. You have to understand that it happens to the best of couples. It happens to doctor couples.
Yeah.
Who should know better how to take care in probably a moment of carelessness. Things happen. Sometimes when you least expect it, it happens. Sometimes it's a failure of contraception. It doesn't matter. The idea is go to a gynecologist, preferably word of mouth. Ask your friends.
Yeah.
Don't be afraid of it. Find somebody you're close to. If it's your partner who's part of this pregnancy, great. If not, your best friend, your sister, whoever is your confidant, take them with you. Go to a doctor. Find the solution forward. The only thing that you need to fight is it gonna be a little upsetting? Yes, but this is not your defining moment.
Yeah.
Just because you not wanted a child at this point of your life doesn't make you a bad person.
Yeah.
Okay, so that's the thing. Fantastic options are available. Fantastic gynecologists are available around the city, around small towns.
Yeah.
Non-judgmental gynecologists are available. Find them, get it done, move on with your life.
Do people come to you asking for an abortion because from some place illegally they've kind of found out that the child is a girl? Has that ever happened?
So they'll never be that obvious in telling us. We are that way very strict. We have a very strict policy. So it's very hard to know. Suppose you don't tell me that I've done a sex determination somewhere in some center and I've come to you, but the numbers don't match up. At least in our center, we don't have only those kind of. It's usually we have very early termination.
Sex determination, again, we just want everyone to know, is illegal in India.
As it should be.
Yeah.
So I mean, a lot of parents will come to me at our urban center in Bombay and say, "Doc, but I want to shop. You know us. It's not like I'm going to do anything." I'm like, look, the law doesn't cater to one segment of society.
Yeah.
Okay. The law caters to the broad consensus. This law would never have existed had people not abused this law.
Yeah. True.
Had people not abused this science, and not just the couples, it's also the doctors who are also complicit in this.
100%.
Okay. So we as a populace right now deserve to not be allowed these things because we've brought it on ourselves.
Yeah.
And the numbers prove it.
Yeah.
Okay. Numbers in certain geographies, the government is very open with the numbers. कहाँ मेल पॉपुलेशन इतना ज़्यादा बढ़ गया है और कहाँ लड़कियां ही नहीं है शादी करने के लिए. There are areas in the country like that.
Some movie made on this also, I'm forgetting.
हाँ,
Yeah.
मतलब it's a reality, no?
Yeah.
I am very staunchly in favor of this thing. Nobody should know. छोड़ो ना, how do I decide आपका चेहरा देख के कि नहीं आप नहीं करोगे? Like what gives me the power to decide कि नहीं this socioeconomic strata of people won't do it? It's rubbish.
Yeah.
Every socioeconomic strata would do it.
No, trust me, I know people who come from the high sort of socioeconomic strata, but they are inclined towards a male heir only.
हाँ, हमें नहीं करना. But fortunately, again, I hope that this thing. I have so many patients, even in our small town hospital in Navsari. It's a cute little small town where we have hospital. We have couples who are like, no, I want to go only. I feel that the change will start to come, and with so many girls now being educated and achieving great things.
Yeah.
And with the advent of YouTube, where people will be seeing videos like this,
yeah,
and so many other videos, this younger generation that will come up, they won't care.
Yeah.
That's the hope.
One hopes.
I'm an optimist.
Yeah.
So I feel that they just won't care. Like in my house, there's no difference between a girl and a boy, and like if anything, the girls are more badmaya, more dominating than the guys.
Yeah.
So that change will come. Yes, of course, we are born into privilege and we have a lot more access to information. Like it will trickle down.
Yeah.
I believe that these policies that the government has right now, they will. You can't see the result in 10, 20 years.
Yeah.
You will see it 2 generations down.
Yeah.
You know, we will see the change in the demographics of the country 2 generations down. So I am very pro not knowing.
Yeah. Fair.
Yeah.
As we have reached the end of this podcast
Already.
The classic question that we have on our show is how do you, in your busy schedule, unwind after hours? What do you do to just relax?
I'm fortunate to have 2 wonderful kids. So for me, going home is going home to my kids. Okay, so I love spending time with my kids.
They're very cute.
Yeah, they are. I got lucky. They've gone on their mom, so and I love spending time with my wife. We watch shows together. We eat our last meal of the day together. So that's now non-negotiable. I miss it the day I don't chat with them over dinner and then get into bed, and sometimes even just watch some rubbish things online, things that have gone viral, office clips, clips from Seinfeld or Friends or any shows that they like. Talk about sometimes in that twilight zone, post dinner and before bed, is when the real gems come out. What happened at school, who's bullying who's done what, teacher gossip comes out. So that's actually my unwind experience, and I watch more YouTube than I should. I watch good shows. I watch documentaries. I love to travel. I love traveling with my kids. That's the time I disconnect completely. So even when I'm at home, half your brain is still at work.
Sure.
But when I'm out of the city, nothing I can do. So yeah, travel is my number one.
Same.
Yeah, I love it. I love it. I love going and traveling India, abroad, everywhere, traveling different foods, talking to different people, walking around with my kids. I like it. I like the independence of thought that it gives you.
Love it. Thank you, Dr. Kapadia. The second time I've called you that ever in my life.
And I think probably the last.
Yes, definitely the last.
So
definitely
I don't think your audience needs to know what you call me
otherwise. No, that's
so we'll
between
keep
us.
It under wraps.
Yeah, we'll keep it under wraps. But thank you for coming and thank you for just being.
I've seen your show, Bani. You've had some really, really fantastic guests. So it's an honor to be called and to be part of that same crowd.
Thank you. And thank you for comforting me when I needed the comfort and almost being the reason why I feel so liberated today.
Yeah, but I have a bone to pick with you.
What?
So every time you used to come to Nama and we used to do your scan or you used to meet me, while going, you used to give me a nice tight hug and all. So, and in front of all the other patients who were with you.
Yeah.
So उन लोगों को लग रहा था कि ये कौन है? So they also think, is this how the doctor is? Is he French? Does he also want a hug? And okay, so one or two of them say, okay, doctor, bye. I'm like, no.
Sorry.
No hugs necessary. I'm like a no touch gynecologist. I'm very
apologize.
Careful.
I made some nurse cry also in this thing.
Yeah.
Not because I was mean. I was chatting with her and I was in my high of the
anesthesia. Oh, I remember this.
Oh God, what a for someone.
But she told you na ho jayega. I remember this whole thing.
Yeah, so I'll tell you what happened quickly. Basically, I've never touched a drug in my life. So now you can imagine what anesthesia did to me. Fun, GA was like I was flying. So I was just like, wow, what is this experience? Don't recommend it. Don't recommend it at all. But in that, it was a painful experience. So it was fine, to just be like, this is not too bad, and I'm waking up, I'm in the recovery room and this is very, very kind. Everybody at Nama is extremely kind and very sweet. And she was next to me and I just got chatty. I like to know,
as Bani does.
Aapka naam kya hai? Aap kahan se ho? Then she's telling me about her daughter and how she's now. Then I said, acha, photo dikhao. I only remember broad strokes of this conversation because, again, I'm in some other zone in life. at that moment. And then she started crying. She's like, "कोई हमसे बात ही नहीं करता है."
कौन नहीं बात करता है? बच्चे मतलब?
Like the patients.
हाँ.
And she's like, "आप इतना पूछ रहे हैं."
Yeah.
So then I was just like, have I just made a grown woman cry by
It's
talking
fine. It
to
was just
her?
kind to her. So
Yeah, but it was fun.
no, we have a great team at Nama, and they're very compassionate.
Yeah.
And honestly, the thing is that it's very hard sometimes when you have a negative result at Nama, because it's like, I mean, there are different ways of going about it. There's some centers are very clinical and they're like, okay, this is science, we'll do it again, it'll happen. In Nama, we take it a little hard. I get anxious on the day of the results. I get very anxious. I get stressed, and then even the sisters and the nurses who've been giving the injections, they're like, "Iska kya hua? Iska." And
Yeah.
then they know it's positive. You can actually see the elation.
Yeah.
And then if it's not happened and they come to meet you, it's like everybody's like, "Oh my god!" Yeah, like, what can we do to kind of make it happen? But like, that's the science of it. You can't change science.
You can't change science, you can't predict anything, but just hope for the best.
Yeah. And just be part of their team. Like, you are on their side.
Yeah.
Like, you need to get that clear that we are all on your team. Let's do this. We're on this journey together. And if you truly are emotionally invested, the patient will know that you are as bummed out as them.
Yeah.
And that helps. And the joys are exponentially more when it does click.
Yeah, I mean, the joy is also then shared and the grief is also then shared, and then,
So yeah, we're a bunch of softies at Nama.
Yeah, I know,
Yeah.
I know. From my experience, I know. But thank you for this. It's been a pleasure, and I will see you very, very soon.
Very soon.
Okay.
It's been a pleasure, and thank you to your team. They've been very gracious and kind. And yeah, great being here.